Starla Howard. I'm the rehab supervisor at the Visiting Nurse Association, Hospice and Palliative Care of Southern California. I manage a team of physical therapists, occupational therapists, speech therapists, and social worker, and they visit people in their homes after they've had some sort of event. So either a fall or some sort of hospitalization for anything. Maybe they had a joint replacement, hip replacement, knee replacement, something like that. We will visit these people in their homes and we will provide skilled care for them. This care is typically covered under their Medicare benefit, Medicare, Medi-Cal, most HMOs. It is a benefit that they have as part of their insurance. I've been the rehab manager for about 5 years, and before I became the manager, I myself was out in the field as a physical therapist for 18 years. So I've been in just about 20,000, probably a little over 20,000 homes. I've seen a lot of patients. I've done a lot of work, and hopefully with some of the hints that I give you here, you can make me and my team less busy. That would be great if we could keep more seniors healthy. So what I'm going to talk about today are some things that are fairly obvious, some things that you may already know about, but hopefully I'll also be able to share some things with you that you haven't heard before and that you don't know. I'll use some real life examples of patients I work with and some friends, and then I'll save some time at the end for question and answer, so that if you have some burning thing in your mind that you want to know about and I don't talk about it, please ask me. I don't want you to go away with questions unanswered today. When I was in people's homes and when I was working with them after their injuries, I would always ask them, what are your short-term goals and what are your long-term goals? Their short-term goal was always, I don't want to be sick anymore. I want to be well again. How can I get well? I want you to tell me that. And their long-term goal was always, I want to live independently. I don't want to have to go to a nursing home. I want to stay in my own home as long as I can. And I don't want to be a burden to my family. So anything you can tell me to help me meet those goals, I want to know about it. And so that was a big part of what I did. And I always enjoyed that work. And I'm going to share some of those things with you today. Again, some of them are very obvious things, but I don't think we can have a good discussion about healthy living without talking about some of the obvious things.